Hi, Michael Bloom, chiropractor. What I want to share with you today is a bit of information, a summary of a research article. I've been a chiropractor for 25 years, and in those 25 years, there's no shortage of times that you get criticised as a chiropractor, but in particular, you get criticised about seeing people when they're not necessarily in pain. So that is other people's perception as to when they should be receiving chiropractic care, purely based around a pain model and a reaction to pain model. So if you like to sort of draw a parallel, that would be like talking with someone about their dietary habits and only suggesting that they follow a well-balanced, nutritious dietary program or plan based around the threat or the concern of a disease process beginning if they didn't follow that. So it's very reactionary. Most people, follow some sort of dietary plan that they know is good for their well-being without waiting until they're in an emergency ward because of poor dietary habits. That's an analogy, because this study is about maintenance care with chiropractic, and it's to do with people that have chronic lower back pain. There were 319 people in the study, and it went over a full year, and it looked at people they divided the people into two different groups. A group of people that went to see their chiropractor purely when they had an episode of pain recur through that year, versus people that had pre-planned appointments in the either 1 to 3 month period in between. And what it showed was that there was actual benefit in people that had the maintenance care program over the course of the year. The benefit wasn't that you won't have another pain-based episode if you have maintenance care. So let me say that a different way. If you had the maintenance care, you could still have a flare-up. But the main benefit was that if you had the maintenance care, you had less pain, activity-limiting pain. So the number of days of bothersome activity-limiting pain within each new low back pain episode amongst patients who had maintenance care was reduced. So it stabilised this clinical course and it increased the number of pain-free weeks between episodes. So what that really tells me is that if you're interested in your quality of life, and let's face it, quality of life will be higher when you don't have limitations to your activity of choice, then in this study, which was done, by the way, in Scandinavia, it shows that if you had the maintenance care, if you take some proactive, preventative maintenance style approach to your spine in the people that had chronic lower back pain, you are likely to have less activity limiting days and weeks. This study was done in 2020, so it's very recent. It's a decent number of people, 319 people. It's a decent amount of time they looked at over a year. That's why I bothered to share it with you, because I actually think there's quite a bit of credibility in this study. And it definitely emphasises and backs up what many of my colleagues and myself have witnessed anecdotally in our own practice day to day. I hope you found it of some use wherever you are on your health and wellbeing journey. I wish you all the best and plenty of encouragement to keep going so that you live an outrageously healthy and long life. Cheers, take care.